Hi everybody, it's Dr. Sherry Caplan at VitalityMD doing another segment on Ask Your Doctor. Today I'd like to sort of talk about sleep deprivation or insomnia, and one of the biggest complaints that a lot of people come in is they're having difficulty sleeping, and so kind of figuring out why they're having difficulty sleeping is kind of the first step, and then we can sort of talk about what are treatment options. So why somebody may not sleep. So again, a lot of women may have hormonal imbalances, specifically perimenopause, menopause, and having hot flashes that kind of wake them up in the middle of the night, or sometimes they're not actually having flashes, but the estrogen's bouncing around that they wake up all of a sudden in a panic, and then kind of have a hard time falling back asleep. And when that happens, you have a lot of neurotransmitters, including cortisol and catecholamines, being released, and then it sort of stimulates the whole system and makes it hard to fall back asleep. So obviously treating underlying hormonal imbalance is helpful. A lot of women might be low on progesterone. Again, progesterone's our natural tranquilizer and sleep aid, so replacing it as opposed to giving a sleeping pill may be a good option. A lot of people who are stressed, that they have mind chatter and they're thinking of all these things. So meditation is a great tool to try to turn down our mind chatter and kind of be present in the moment. And there's many different ways to do meditation. A lot of people say I can't meditate and I can't quiet my mind. Well, there's apps, there's binaural beats, there's different types of meditations, there's guided ones, there's ones that's more technology that try to get your brain waves to go in a sort of meditative state. So I tell people try out different ones and find out what works for them. Other things why people may not sleep. So again, a lot of people have their cell phones or computers or electronic devices near their head when they're sleeping, and that can impair melatonin. So I tell them turn off your computers, don't have any electrical things plugged in by your head, get your phone out of the room and shut off, and if possible even turning off the Wi-Fi at night. So that may be helpful. Again, people may be doing shift work, or again, because we get a lot of blue light before going to bed, that it inhibits melatonin. So turning off your technology 3 hours before, maybe considering using blue blockers to turn off the blue lights, or on your computers or cell phones you have the night shift app. So that may be another way to sort of help with that. And other people may have sugar dysregulation in the middle of the night, so they might have something sugary before going to bed, or an alcohol drink, and then what happens, they get reactive hypoglycemia, and in the middle of the night they might either wake up with a flash or night sweat, or actually wake up because their sugar is too low. So again, normalizing your sugars before going to bed, maybe having a protein snack or a bit of a fat may help with that. So those are a lot of things that may contribute to sleep problems. And then what are things that you can try to help you with? So I use a lot of magnesium. People tend to be magnesium deficient, so kind of dosing magnesium into bowel tolerance may be helpful. Melatonin may be helpful. The blue blockers may be helpful. For stress, I use a lot of an herb called ganda or ashwaganda, which seems to give you energy during the day and help you sleep at night. Kind of helps with that mind chatter. Theanine is another great one that kind of helps with that mind chatter. Lavender essential oils, take an epsom salt bath before going to bed, creating a ritual may be helpful. So I would sort of say that's sort of a nice little grab bag of things to try, and if that's not working, then we can always look at alternatives. So that's my sort of take on how to improve sleep, and obviously again, fixing those hormones is hugely efficacious for sleep as well. Anyways, thank you everybody. If you like what you heard, like us on Facebook, share us. If you have any questions, send it to info@VitalityMD, and have a good week.